Whether you're a parent navigating myofunctional disorders or simply curious about optimizing your family's health, the Myohacker podcast is your guide. Hi, I'm Karindy Ong, a speech-language pathologist, myofunctional therapist, and mom on a mission to bring holistic health to you and your family. Together, we'll explore whole-body connections and integrative solutions. Please subscribe and leave us a 5-star review to help other families discover this podcast. The content shared in this podcast is for informational and entertainment purposes only. The views and opinions expressed by the host and guests do not necessarily reflect those of the podcast or its affiliates. This podcast does not provide medical, legal, or professional advice. Visit myohackerslp.com for free guides and access to my online community and courses. Now, let's dive into today's episode. This question was submitted by an adult. She said, I don't have speech problems. I have jaw problems, which have turned into neck-shoulder problems. I have advanced arthritis in my jaw and have torn the meniscus on my right side twice. Add to this that I have a weird oral allergy thing going on. My tongue and jaw are working overtime. My neck hurts. It also has advanced arthritis. I'm almost afraid to tell you I've done Botox and the masseter several times to help with clenching, but now I'm just clenching different muscles. I'm at my wit's end. My vocal coach suggested I talk with you. If this isn't something you can do, perhaps you could direct me to someone who could assist. So this is something, for one thing, I love it when voice and vocal coaches direct care to a myofunctional therapist. It takes a very knowledgeable vocal coach to do this. So it makes me really happy when I see that. Let's go back. Okay, we're going to talk first about the neck and shoulder problems. So already I'm going to be thinking, let's take a look at the possibility of a tongue tie. Because when we have tethered oral tissues in the mouth, especially a tongue tie, you have to strain more, you have to move a lot more muscles to get the same activation that you would have to engage without so much movement. So it is not uncommon for individuals with a tongue tie to have neck and shoulder problems. Actually, it's the opposite. We expect to see that as we get into adulthood. You don't hear these complaints in children so much. Sometimes you do, but usually it's once we get a little older that we start to have the pain, and this sensation really can kick in. So with the advanced arthritis in the jaw, that is going to be something already I'll want her working with a TMJ specialist. We need to get a CBCT, which is a cone beam CT scan to see where is the condyle, where is the joint right now. I'll want to make sure that we have a specialist who that is their designated area, because myofunctional therapy, we're going to be moving the mouth, we're going to be moving the tongue, and I want to make sure that her joint is, I won't say that it's safe because we're going to be moving it, but that she is under the clearance and the observation of a dentist who knows what we're doing and has given us the okay. So that's very important. She, tearing the meniscus on the right side twice. Already, I'm like, all right, we have a lot of tension on this right side, just what she's describing, which it's not uncommon for us to have more tension on the right side just because of the two lobes and in the lung, and then the way the ligament runs through the diaphragm, the way we're breathing and the way we're moving through the world, we do often have a lot of tension on that right side. So it's not wildly uncommon for us to see that, but we should be able to even out tension and movement throughout the body instead of her right side taking the hit so much. So that is going to be something in myofunctional therapy. We'll be working on how she's breathing, engaging the diaphragm, and I am likely going to refer her to a PT or a chiropractor. I would need to see her a little bit more to determine what treatment approach I would like, but I would love for her to have someone that's working with really her engagement of her belly, of how she is rotating, how is she turning, how is she moving her arms, what is she stabilizing with? These kinds of movements. Over time, when we have patterns, we can wear ourselves down and get injured, and that is not what we want to do. So she also mentioned Botox. So Botox is something that people will utilize it goes in and it reduces that tension, specifically in the masseters. That's where you often see the injections placed. But like she said, she's now clenching with other muscles. So that takes us back to, okay, is this a muscle tension release that is someone using this tension out of stress, which is what people are usually told. Oh, you're stressed. You need to breathe and you need to handle stress differently. Okay, it's not very helpful advice, but it's what people hear a lot. But I would actually argue it's likely that it's her airway. And when we clench our jaw, we dilate the airway and we give ourselves a little bit more space so that we can breathe a little bit easier. The way that it just tightens the soft palate, and it tightens just that space in the back where the tongue is, you get a little bit more room to breathe. But it also can be a way to wake yourself up if you're in those deeper stages of sleep. So that's where your body, as you relax and you get into that deep healing stage of sleep, your muscles can relax to the point that we have an apneic episode or we have difficulty breathing in that state. And that's when the brain goes, uh-oh, sends a signal for us to clench, because that wakes us up a little bit. We are a little bit more alerted. It's not uncommon for people to wake up having the need to go to the bathroom, things like that. The body will go, let's wake them up because they are going into this deep sleep and we're not breathing so well. We don't want to have that. We need to prioritize breathing. So it's not uncommon for that to be the case. It can also be how she is hitting, like her occlusion. So again, very important that we're working with the dentist to look and see, did she have dental work previously that now she's hitting in such a way that it just can be a cyclical response where, people can feel a relief. It's a dopamine rush when you're biting, when you're clenching. We all love snacking, it feels good. And so you can have a little bit of that neurotransmitter signaling that's going on as well. So it's very important that we look at, is it structural? Is it that it's functional, that she's trying to breathe better? Is it that it's neurochemical, that she's getting this input, which we see that if you are not sleeping well, you need some stimulation throughout the day to stay alert and stay awake. And so clenching is one way to do it. Chewing gum, all these things keeps you a little bit more alert. Then she said, well, and then of course she's at her wit's end. Yes, when we are working with jaw pain and with jaw issues, it's exhausting. Okay, it is. She didn't talk about headaches here. I would suspect she probably has headaches. Also would expect she's probably just, it can cause a lot of anxiety, because when you're in pain, you're just more likely to have anxiety. So all of these things, yes. And I messaged her back. And so we talked about next steps, but it is so important when it comes to jaw pain to not just go out and get a bite guard, because sometimes that can make it worse. And so we don't necessarily want to do that. We want to actually treat the underlying issue, and that can really help. So this question came in and this person said, saw you on YouTube, which I'm so curious, because let me know where you saw me on YouTube, because I don't know where I'm at on there right now. I have a channel started, guys, but there shouldn't be anything really loaded up yet. So wondering if you can help with my 6-year-old. He's been potty trained since he was 2, but nighttime bedwetting started soon after that. I have noticed that there are breaks in his breathing pattern while he sleeps and his mouth is open. I want to help him now. He just figured out that bedwetting is not normal for his age, and that breaks my heart. Yes, isn't it? Oh, it's so tricky. As parents, we're trying to support our kiddos as much as we can. And then, we know, okay, there's a delay here, or this is a dysfunction. And then when our kiddos get that awareness, it just hurts. So I feel for you, and I want to give you some solutions to consider. First, I would say let's make sure that we are working with an airway-centric dentist. 6 years old, a lot of the sayings are fixed before 6 when it comes to airway expansion, palatal growth and things like that. So I would say, if possible, get them in to see an airway-centric dentist sooner rather than later. We really want to use this time while the bones are developing and we can make cranial structural shifts easier, and that's just going to be a priority. So getting in with an airway-centric dentist who sees kiddos that are younger, if they go in and they're like, we need all the 6-year-old molars in and I don't see those, that's not the person you want to see. You want to see someone who specializes in treating airway in younger kiddos. So it is something that we want to see if we can get that addressed. Also working with a myofunctional therapist. A feeding therapist is possible depending on the sensory needs. I don't know though, you didn't clarify if there are sensory seeking issues here. I just say that because sometimes with a 6-year-old, depending on where they're at developmentally, they might need more of a feeding approach versus more traditional myofunctional therapy. But it's easier to start, if you can, with myofunctional therapy and just move straight in to that expansion approach if that works for them, if the dentist says that they need the expansion. So it can also be that we need to actually start with pelvic floor therapy. There are a couple of really great, actually there are a few great pelvic floor therapists in the Houston area, which I'm super grateful for. Not everyone has access to a great team of pelvic floor pediatric therapists like we do here. But it is something that, given this pain point, I would likely prioritize it in that way. I would say, okay, see the airway-centric dentist first, and then start with the pelvic floor therapy, just because we can help so much with what is going up the chain when we actually support the pelvic floor. Because sometimes as kiddos, their posture is changing with their swallow, as they're trying to adapt to, especially if they have a tongue tie, they've got this instability that they are trying to manage. Like, it's really hard for them to move their tongue. So they might be anchoring with their pelvic floor in a different way. They might be tucking under. I see that a lot, that kids are kind of seated in a C curve position, head's tilted down, sacrum is tilted under, and it's tricky to get that movement, that opening up of the floor of the mouth, of the back of the head. We want to have this expansion of the fascia itself. We want it to really open up and be nice and wide and broad for us to then have that big, beautiful swallow and that rhythm all the way through the craniosacral system. So sometimes it can be working with a pelvic floor pediatric therapist, and they can help you with that. So especially because we want to intervene because of his age and now his increased awareness. He now realizes, wetting the bed, no, this is not normal. This isn't something I should be doing. We don't want him to incur these feelings of shame and less than. We want to be very mindful of that. So that's where a pediatric pelvic floor therapist can be amazing at helping with that, as well as a nervous system-based chiropractor. So this, again, it kind of depends on where you're at and the providers you have in your area. So if you are in, and I don't know where this family is located, but if they are in a place that it's easier for them to see a chiropractor who's going to help them with the craniosacral system, with getting the sacrum to unwind and open up differently, then that would be amazing. If they can't get in and see a pelvic floor pediatric therapist that's going to help them with voiding and getting tone, because a lot of it too can be core issues that they need that support for. So that's where it's really great to have a team nearby that you can work with. And it's just, like I said, because of that age, because of those needs, we want to be addressing what is going to address his identity and how he feels and sees himself first, even though the underlying issue might be airway driven. That's why we start with the pediatric dentist, see if we can get a myofunctional therapist, but I would prioritize that pelvic floor PT ASAP. I hope you enjoyed this episode of the Myohacker podcast. Remember, small changes can have big impacts on our overall health and well-being. If you enjoyed this episode, please take a moment to rate and review the show wherever you get your podcasts so more people can learn about the show. Head on over to myohackerslp.com for in-depth resources, free guides, and access to my online courses. You can also join the fun on Instagram at Myohacker-SLP for bonus content and updates. And if you have questions or topic suggestions for future episodes, please send me a message. I would love to hear from you. Until next time, let's biohack myofunctional health as myohackers who change the world through intentional action and connection. Quick disclaimer. The content shared in this podcast is for informational and entertainment purposes only. The views and opinions expressed by the host and guests do not necessarily reflect those of the podcast or its affiliates. This podcast does not provide medical, legal, or professional advice. Always consult with appropriate professionals regarding your individual circumstances. By listening, you agree that the host and podcast are not responsible for any actions you may take based on the information provided. We encourage critical thinking and urge listeners to verify any claims or statements made during the show. Your mental and physical well-being are important to us, so please listen responsibly and prioritize your health and safety. Thank you again, and Myohack on.